My name is Evgeny from the Rutgers University Center of Alcohol Studies, and I wanted to give you a quick overview today of a new study myself and my co-authors are publishing in Addiction Research and Theory titled Heart Rate Variability, Biofeedback, Theoretical Basis, Delivery, and its Potential for the Treatment of Substance Use Disorders. So this article gives a brief overview of what heart rate variability biofeedback is, which in essence is a special paced breathing technique delivered with the help of biofeedback. This intervention has been shown to be effective for ameliorating symptoms associated with a number of psychological disorders, including major depression, certain anxiety disorders, PTSD, and a host of other problems. Now, only one clinical trial to date has tested whether HRV biofeedback might be effective for the treatment of substance use disorders. And I should note, to date, no large-scale randomized controlled trials have been conducted testing HRV biofeedback's efficacy or potential effectiveness for treatment of any psychological disorders. However, there is a growing body of literature suggesting it may be an effective intervention for a number of disorders. And in fact, because of this growing body of literature, we suggest it may be effective for a number of disorders, highly comorbid with addictions, but disorders also that share a lot of common symptomology with substance use disorders. I make the case in this article that HRV biofeedback may have a place in the treatment of addictions, not necessarily as a first-line treatment, but as an addendum to treatment as usual. And I argue this because heart rate variability biofeedback is very cheap to deliver, has no negative side effects, and can be used either acutely or chronically by the patient to affect changes in mood or affect, to help them regulate strong affect in the moment, and also to restore balance in the autonomic nervous system, because we know heart rate variability biofeedback increases parasympathetic activation. So we know that HRV biofeedback has tremendous potential. More work is obviously needed at this point, and I would implore researchers out there to engage in randomized controlled trials of HRV biofeedback for addictions, because it certainly seems like it has some